I want to turn now to our next speaker, Ayesha Khan, who is a graduate from Boston University with a BA in Applied Mathematics and Statistics. For a decade, she worked at Vitamin Water in New York City, and after moving to Nantucket, Massachusetts, she worked for a local surgeon, Dr. Leopre. Currently, Aisha, her husband Nate, and their two young kids live on the island of Nantucket, where Nate works as a firefighter and Aisha is a stay-at-home mom. Nate was recently diagnosed with testicular cancer. With Nate now in remission and in researching more about his cancer, Aisha found out about PFAS and its connection to AFFF, or aqueous firefighting foam, and the firefighter gear that firefighters wear in their turnout. She co-founded Nantucket PFAS Action Group as an educational resource about the hazards of PFAS and a space for the local community members to openly discuss concerns, thoughts, and experiences. And she's going to share some of those with us now. And thanks, Aisha. The floor is yours.
Good afternoon, esteemed members and staff of the National Academy of Sciences, Engineering, Medicine, and moderators and fellow liaisons. Thank you for giving me this time to speak. We have been asked to share community experiences regarding PFAS contamination, and today I will discuss my experiences that highlight what exposed populations undergo. I'm here because firefighters are dying of cancer. I'm here because young and old firefighters are fighting cancer from simply doing their jobs. My name is Ayesha Khan, and I'm here because my husband has cancer linked to PFAS exposure. The community I'm here for is the firefighting community that can't seem to get industry, scientists, doctors, and lawmakers to stand up for them. There are 1.2 million firefighters across America who risk their lives to keep us safe. They have sacrificed their bodies, health, and minds for their jobs. They have also been unknowingly poisoned by foam and gear manufacturers. These products have been deemed safe by industry-funded scientists, but are not safe. The cause of firefighter cancer hasn't been addressed because doctors are not aware of the dangers of PFAS, or because they are too afraid to take a bold stand. Political leaders and union leaders have also neglected firefighters because their pockets have been lined by PFAS industry to turn a blind eye. To add insult to injury, the same gear that was intended to protect firefighters are a significant source of PFAS exposure. Firefighters are still forced to wear gear with PFAS since alternatives are not available on the market. Even my husband, whose gear contributed to his cancer, has to put on the very gear that made him sick every day that he goes to work. Firefighters eat, sleep, work, and exercise in a house that is suffused with PFAS dust. Forever chemicals are on every surface they touch. The least that we can do is inform them of this issue and allow them to measure their exposures. When my husband joined the fire department 15 years ago, heart disease was the #1 leading cause of death in the fire service. When my husband was diagnosed with testicular cancer in 2019, we learned that we were just one more case in an alarming trend. According to the International Association of Firefighters, cancer has caused 66% of firefighter line of duty deaths from 2002 to 2019. Heart disease now accounted for only 18% of line of duty deaths in that same time period. Department of Defense military firefighters get PFAS blood work done at their annual physical. Yet, civilian firefighters are in the dark. CDC recommends limiting exposure to PFAS, but this is an extremely difficult task when many firefighters still haven't heard of PFAS. Firefighters are not given any guidance on managing, handling, replacing, or even the health issues connected to PFAS or gear. Our inability to get information to the general public leads to situations like the following. Here, firefighters across the nation were told that the foam was simply just like dish soap, and it worked very well to clean. So fire stations were known to wash their cars, walls, floors, and sometimes even their dishes with AFFF. I've even heard of some firefighters who have used AFFF in the shower or even to brush their teeth. The bottom photo here is a scene from Australia where many fire stations will spray foam in the yard so that it will look like snow and that the children can play in it. All the children in that picture on the bottom had cancer. Many fire stations across America have been known to use AFFF for slip-and slides or to host community foam parties. Since it was deemed safe, some departments would celebrate milestones by throwing AFFF on you or your car, as you can see in the top photo there. It is difficult to tease correlation apart from causation, but firefighters should not have to wait for the science to catch up in order to get blood work. Firefighters are exposed to PFAS daily, and we want to know the levels of PFAS in their blood. Blood work helps establish baselines, raise awareness, and most importantly, it empowers the people to be proactive in their health and reduce exposure. The current ATSDR clinician guidance emphasizes limiting exposure to PFAS, but gives no clear recommendations. If the document is followed exactly as written, it creates a situation where a physician becomes a barrier to information about the effects of PFAS on the people who are exposed, like firefighters. It shifts the burden onto the affected community members to advocate for themselves in a confusing and oftentimes hostile environment. Firefighting foam and gear not only harms the firefighters using them, but also contaminates the communities they serve. This is Felix. Felix was diagnosed with leukemia when he was 8 years old. In 2009, when Felix was 2 weeks old, his family moved into a house about a football field distance from the airport in our town. Felix has 2 younger siblings who were born in that house, and they both have learning disabilities. When Heidi, Felix's mom, heard about the PFAS contamination in the wells next to the airport, she wanted to get her children's blood work measured for their records. She made an appointment with a doctor who is a specialist on childhood poisoning in the top hospital for children in New England. A doctor who gives presentations on PFAS and advises other doctors on PFAS exposure. Heidi asked me to join because she knew about my husband's cancer and his PFAS exposure. We asked to get PFAS blood work so that we could have a baseline level for Felix's blood work. The doctor said that because Felix was currently healthy, ATSDR recommends to continue with his yearly annual physical with the option to add a lipid test and to continue treating Felix as you would a patient who did not have PFAS exposure. He explained the challenges of PFAS blood work. It's hard to find a lab. They can be expensive. The insurance does not cover it. The doctor let us know that he was following ATSDR policy and said they had reservations on doing blood work because when it came back, we wouldn't know what to do with it if the levels were elevated. During the appointment, I felt that the doctor tried to minimize the situation. He referenced a study in which mothers whose children had prenatal exposures to PFAS chemicals had higher reading levels at ages 5 and 8, and then joked by no means were they suggesting to give children PFAS. The doctor told us that the sites that they had done community testing on, sites like Pease Air Force Base, had similar PFOA and PFOS blood levels compared to the national average. He said that PFAS levels from the ATSDR exposure assessment sites in Washington, Delaware, and Massachusetts did not find much. This is not true. I know these towns, I know their community members, and I know their results. As you can see from these charts, all of these communities have elevated blood levels compared to the national average. I feel as though he was lying in order to dissuade us from requesting blood work. This behavior is dangerous, especially given the amount of credibility and the authority he has. When we pressed him, the doctor concluded by saying that if we were still interested in getting PFAS blood work, the best option would be to go back to our primary care provider and ask them. He would not order the test. The next week, Heidi took Felix and his sister to their local primary care provider, who tested their PFAS blood levels without any hesitation. If I had not joined Heidi on that first hospital visit and pushed the doctor, Felix and his sisters would still not have the necessary blood work done. The general population believes everything we purchase is safe and that our government strictly assesses and regulates chemicals entering the consumer market. We are not scientists or doctors. We assume our government is keeping us safe. And when there is a possible link to adverse health risks, we are led to believe that issue is promptly resolved and not with a regrettable substitution, another term that we have had to teach ourselves. My hope is that the National Academy of Sciences, Engineering, and Medicine will educate our healthcare professionals to be honest with those of us who have been exposed. We cannot turn back the hands of time and eliminate or reduce our exposure, but we can make it easier for people like my husband and Felix to get medical monitoring and the attention that they need. We need your help today. If we can educate our healthcare providers, lawmakers, our union leaders, it will help all of us who have been exposed from these forever chemicals. Thank you very, very much for your time. Thank you.
And thank you, Aisha, for that story and the concerns that you're raising.